Welcome. Thank you for joining us today for Kennedy Krieger Institute's Exploring the Brain webinar series, which we've offered to our donors and friends. I'm Linda Cameron, Vice President of Philanthropy, and I'll help facilitate our program today. Our topic for this first webinar of 2023 is Shaping Our Future. This is an annual update from our President and CEO, Dr. Bradley Schlager. He will highlight recent events at the Institute, news, accomplishments, and provide a perspective on our future. Dr. Schlager joined the Institute in 2018, and he holds the Zanville Krieger Faculty Endowed Chair. He is also a professor of neurology and pediatrics at Johns Hopkins University School of Medicine. At the Institute, Dr. Schlager leads a team of more than 2,700 staff and faculty members, all focused on our mission, which is to improve the lives of children and adolescents with disorders, injuries, and diseases that impact the nervous system. We are thrilled that renowned journalist and Kennedy Krieger board member Judy Woodruff interviews Dr. Schlager. Ms. Woodruff is a senior correspondent and former anchor and managing editor of the PBS NewsHour. Due to a last-minute change in her travel schedule, the interview is recorded. Dr. Schlager is live with us, and he will answer questions submitted by you at the conclusion of the interview. Hello, Dr. Schlager.
Welcome, everybody, and thanks, Linda, and looking forward to catching up after the video.
Terrific. In terms of logistics for everyone, please enter your questions in the Q&A section of Zoom, which is often found at the top of the screen, depending on your device. And there will be plenty of time for questions and answers at the end of the interview. Now I will turn to Dr. Schlager and Judy Woodruff to begin today's program.
Judy, I'm so glad to be here with you for this special conversation about Kennedy Krieger. Thank you for lending your talents to our discussion today. And one of the great pleasures of my job has been to get to know you and your family. But before we dive in, could I just ask you to tell our audience a bit about your connection to Kennedy Krieger?
Thank you, Brad. I'm so happy to be here with you and with all of you. And I have to say, one of the great pleasures of your time at Kennedy Krieger is we've gotten to know your family as well. And that has been a special treat for us. So our connection to Kennedy Krieger goes all the way back to 1998. We have 3 children, and our oldest, our son, Jeff, who had been born with spina bifida, a very mild form of it, in 1981. In 1998, he was 16 years old and had done very well. He was at grade level in school. He had some minor challenges, but it was advised he go in for a shunt replacement. Perhaps some of you listening will know what that is. And it involved a procedure that unfortunately and tragically in surgery, something went really terribly wrong. And Jeffrey came out of that surgery here in Washington, D.C. In a coma and unable to communicate, to eat, to basically do anything. And we were quickly looking for the best place to go to get the kind of treatment that Jeff needed to address what had happened. And the first place that was recommended was frankly right down the road, right up the highway from Washington in Baltimore. And of course, that was Kennedy Krieger. And we made contact with the folks there, with your predecessor, Dr. Gary Goldstein, and people could not have been more welcoming, more inviting. We made connections with the doctors at Johns Hopkins who worked in neurology, neurosurgery, and we made that connection. So in the late summer of 1998, Jeff was transferred from DC to Kennedy Krieger. He spent 4.5 months at Kennedy Krieger as an inpatient. He came out of the coma in October and had to learn how to eat again, speak again, talk again, and just frankly relearn so many things. And it was due to Kennedy Krieger, the physicians, the physical therapists, the occupational therapists, speech therapists, recreational therapists, frankly, the small army of specialists and just wonderful, wonderful people who worked with Jeff so that he was able to leave Kennedy Krieger right around Thanksgiving, right around my birthday in late November of that year. And we've been in connection, in contact ever since. Kennedy Krieger has been an outpatient source of treatment for Jeff over the years, and that continues to this day. Jeff is now 41 years old. He lives not too far away from Baltimore, and he comes there periodically for appointments. So Kennedy Krieger is like a member of our family, and we will be, I can't say it enough, forever grateful to what Kennedy Krieger has meant to him and to all of us. So we are one appreciative family. So Brad, let's turn this back to you now. You've been there as the lead person for the last 4 years. You came from another institution in St. Louis, where you already had a distinguished career. But has Kennedy Krieger been what you thought it would be? Has your time, your experience been what you expected?
Well, I certainly didn't expect a global pandemic. So I need to say, in some respects, no. And I'm really glad to have had about 18 months at the position, which really helped me for navigating what came with the pandemic. So despite the pandemic's massive disruption of all of our lives, the tragic and enduring consequences, the disruption of typical operations for the Institute, I've really learned and experienced firsthand the resilience, the resolve, and the culture of the Kennedy Krieger team. And not just our team, our patients, students, and their families, their resolve as well. I like to say that the culture of a place really shows itself under duress, and that's what happened. I expected this place to be remarkable. That's why when I got tapped on the shoulder, my family and I, we said yes. But I've learned just how remarkable we are in the face of extraordinary challenges.
And they were extraordinary. So much of that due to the pandemic. But let me just ask you, I mean, how were you able to get through this with everything going on in the world around you, with the entire population locked down for a while? Were you able to work with patients? What about your employees, the medical staff, the entire staff that Kennedy Krieger is? How were you able to do this?
Well, it's been essentially 3 years now since the beginning of that public health emergency declaration for COVID, and that caused really abrupt changes for everyone, especially in healthcare and education. But we are a nimble organization. Our staff, we're talking about nearly 3,000 employees across nearly 24 sites around Central Maryland, but nonetheless, we're nimble. And we also, we believe and live a shared leadership approach. And that culture really allowed us to transition promptly to providing services via telehealth and distance learning, while also maintaining a safe environment for all of the clinical care that needed to happen on site as well. We also, I think, dealt with all the other issues that were going on in the world that were in addition to the pandemic, that were affecting the day-to-day lives of our staff, as well as the people that we serve. And then in the past couple of years, we managed to transition back to, I wouldn't say it's normal operations, but it approximates normal in a lot of ways. And we never did shut down entirely clinically. We never stopped serving our patients. Even when we had to go through that transition, we maintained a safe environment for the patients that had to be on site, our inpatient hospital and a whole bunch of the clinical programs. And then in terms of our schools, we, except for 2 weeks where the state of Maryland closed down the schools in general, we did not interrupt services for our students either. And I think that's a really remarkable accomplishment. And we were working on our strategic plan in the 6 months or so that led up to the public health declaration emergency, and we were starting to show the framework of that strategic plan to our staff, like through town hall meetings, and then hit pause on that. But even with that pause, and even with the complication of life during the pandemic, we were still able to accomplish a lot in the last few years. And I know we have a relatively limited time here, but I think it's important to just talk about some of those accomplishments. And when I describe it, I get to be the voice of this, but I'm talking about this massive team of collaborative, mission-driven people who comprise that team. And, I have a set of things that I want to share, and it's only a subset of what we were able to accomplish. I think first and foremost that I'd like to start out with by saying that we saw a record number of patients and students. Just this past year, we saw more than 27,000 unique patients and students, getting close to 300,000 outpatient visits in the year. Another area that I think, a broad area that I'm really proud of is we've been very intentional about working at the state of Maryland and the federal level to secure funds in the form of grants primarily, but these are to support all segments of the Institute. Just in the last couple of years, we've been awarded over $35 million for important projects and initiatives, and I think it's worth naming a bunch of those. So, for example, those funds, $35+ million, some of it is going to our Kennedy Krieger Institute Center for the Neuroscience of Social Injustice. This is a program, a center that we're just building right now to understand mechanistically how social determinants of health adversely affect health outcomes, including and especially for individuals with intellectual and developmental disabilities. We have funds to improve the facilities for our LEAP school. That's our life skills and education school focused primarily for children, students with the most significant burdens from autism. And it's to improve the facilities of that school. We have funds that are to build and operate what will be our 5th Kennedy Krieger School. We're very excited. We're opening a school in Southern Maryland, in St. Mary's County, and that'll be in the late summer of 2023. It's our first foray outside of Central Maryland. We're replacing and updating our air handlers and HVAC improvements. And while I don't think people might see that as sexy or intriguing, but it's so important because it's a way to keep the air quality safe for our students who are most vulnerable for adverse outcomes from something like COVID-19. We have significant funds from the state and from the federal government to create a new integrated early learning, early childhood center to develop and implement a comprehensive, family-centered early childhood program that's focused on at-risk young children, both with and without developmental disabilities, so an inclusive kind of early childhood program. We've got funds to support our pediatric post-COVID-19 rehabilitation clinic, which we believe was the first such clinic, pediatric such clinic in the country. We have funds to improve our Fairmount campus, which the clinical sites, which have outpatient venues for pediatric rehab and neuropsychology. We have funding from the state to improve our primary site for our Center for Autism and Related Disorders. We have funds from the federal government to provide devices and hotspots to assure connectivity for patients, students, and families to help close the digital divide and reduce inequities in access to care and education. So I mentioned also that we just got through our accreditation cycle for the Joint Commission and the Center for Accreditation and Rehabilitation Facilities. These are the accrediting organizations that make it possible for hospitals like ours to keep doing the work we do. This got the CARF, the rehab facility, that was just last week. We got an A+, by the way. We've hired.
Congratulations.
Thank you. In the past 2.5 years, we've brought on more than 40 new faculty physicians and psychologists and scientists. And that's a really outstanding accomplishment in a competitive national market, being able to recruit these pediatrics subspecialists and scientists who focus on our mission-driven work. We've published over 400 new research papers. We've 36 new federal and foundation research grants and lots of new human subject protocols for our research mission. And quite importantly, just in the last year, we had our board of directors approve our strategic plan, which I consider to be not limited to the next 5 to 10 years, the standard planning, but really a generational plan. I could go on. But-
Well, let me just ask you about that. But I have to say, listening to you, I marvel at how, I mean, Kennedy Krieger was already a great institution when we became acquainted with it over 2 decades ago. But to listen to you lay out again, describe how it's expanded, the many services you're offering to, yes, to individuals who have a particular diagnosis, but then broadening that mission to serve so many children, as you mentioned, with special needs, and even those who don't have special needs, but who are in a disadvantaged circumstance. And Kennedy Krieger is uniquely positioned to meet so many of these needs. It's all very, very exciting, and it's a lot. And so that, and again, I cannot praise the Kennedy Krieger staff enough. There's no one I've encountered, no one I've worked with, dealt with over these years in connection with our son Jeff, who hasn't been just phenomenal in compassion and expertise and in every regard. But let's go back to that strategic plan, because building on everything you've described, give us a peek, a sense of what you're thinking as you look to the future.
I think a very exciting strategic plan. There are 12 facets or aspects to that plan, and then they really roll up into 4 main focus areas. Number 1 on the list would be education. We talked a bit about some of our schools. We have 5 early childhood programs, as well as 4 schools, about to build our 5th. And we also have our post-secondary programs that focus on helping neurodiverse individuals join the workforce. The next would be research, including the establishment of a center that's focused on specialized education for students with intellectual and developmental disabilities, as well as reimagining our clinical trials unit, increasing the number of endowed professorships to recruit and retain world-class talent, and some other focus areas. Patient access is another one of those domains. We are working on increasing our ability to see more patients in a timely fashion, as well as building capacity in the community to manage common developmental issues. And then probably the biggest lift is what we've referred to as our innovative care center, the construction of a new tower that includes, among other things, a larger inpatient hospital. So those are as I said, there's 12 facets, and they sort of roll up into these more focused areas of the strategic plan.
So the first thing you raised, Brad, was schools. And I know that's been a part of the Kennedy Krieger mission for some time. Our son Jeff participated in one of the schools there in Baltimore when he was an inpatient, and then later when he came home, he commuted. But tell us more about the schools. Take us inside what Kennedy Krieger is doing in the education arena.
Well, you're quite right. The educational mission has been core to the Institute for decades. The building I'm sitting in right now in East Baltimore is the original Kennedy Krieger East Baltimore building. And at one time, everything that we did, including our school, was inside this building. This is at that time, we had maybe 250 employees and served about 2,000 patients and students. So in the decades, the last 35 years or so, we've grown by an order of magnitude. Our school contribution, our educational contribution, has evolved during that time. At this time, we are part of what I think of as the undergirding of the public school system of the state of Maryland. So we have 4 schools right now. 3 of them are in Baltimore City, and 1 is in Prince George's County. They include a K-8 setting, as well as a high school, that LEAP school I mentioned earlier, the autism focused school, and then the school that's closer to DC in Prince George's County. And as I said, we're building that 5th school. We serve publicly funded students. So we're a private institution. We don't take tuition. We serve students that are referred by local school systems when those local schools are unable to provide the students what they need. So we're talking about children who have intellectual and developmental disabilities, often also psychiatric and medical complexity. and behavioral challenges. So those are students that, but for schools like ours, would not have a pathway to education. And across all those schools, we're talking about 500, we'll get up to about 550 students when we build that new school. So that's not out of the 1 million public school students in the state and 100,000 who get IEPs and individualized education programs, it's a small number, but it's an important contribution because but for such programs as ours, the local schools would have to build what's necessary to take care of those students. So we see ourselves and we are seen as critically important to the students we serve, but also to the broader public school systems throughout the state. So that's our schools. We also have early childhood programs. And I think that's an underappreciated part of our contribution as well. We have a multitude of early childhood development and educational settings, including a medically fragile daycare. What that means is we take on young children who would not typically be able to be served in a typical daycare setting, and it's staffed with with people who can take care of complex medical needs, and that allows those parents to go to work. We also have a traditional early Head Start and Head Start programs. We have an inclusive autism, and in our autism center, we have an inclusive preschool setting that has kids with and without autistic features. And we are, as I mentioned, we are building this new inclusive early childhood center that's going to be on the western edge of Baltimore City into Baltimore County, serving at-risk students in an inclusive environment. So our footprint in early childhood education and education per se is really significant. And in fact, we just recruited a director of early childhood development and education to lead a sort of a consolidated approach to all of those early childhood programs, to create vision for our direction in that area, and also to help advocate at the state and federal level for more cohesive and consistent funding approaches to such programs such as ours. We're not alone. These are challenging programs to stand up and sustain. And so our intent is to serve, but also to help make the world a more a place where early childhood programs can be more successful in general.
It's all so important, and it's impressive to watch Kennedy Krieger make these expansion to meet these needs that are, as you point out, they've been there for a long time, and our society, our country, the state of Maryland, are beginning to meet those needs in such a critical way. I want to ask you about patient access, because it's something I think you touched on before, because we know every family, the need is enormous. The need is huge. How does that work? Is every family who needs help for their child able to get it? How does that work?
We would love to be in a position where we could serve every child who needs our services directly. And we know in a practical sense that that's not possible. That said, we do think that we have opportunities to create more easily create access for patients to get in our front door and to move seamlessly through the Institute. So that's a reason why we just hired an assistant vice president to take on patient access so that we can address the operational elements. We're going to ramp up a rapid access program and a patient navigator program. So while we can't see everybody, we know we can see more patients. But access, we think of access as having there's a small a access operational, but also big A access, which is more the concept of capacity building and broadening the ability for providers in the community to be able to take on common developmental issues. For example, there's this kind of program called Project ECHO that stands for Extension for Community Healthcare Outcomes. We didn't invent it. It was actually invented by a pediatric gastroenterologist in New Mexico. But the concept is that through the expertise of a specialist, you can amplify, through training community providers, you can amplify the ability to see patients closer to home, closer to their medical home, and to take on common issues so that specialists can focus more on the children who have more significant needs. So we are doing that. We have a program where we are, for a couple of years now, including funding from the state of Maryland to help make this happen. We are training early childhood providers, as well as healthcare providers, general practitioners, pediatricians, nurse practitioners, et cetera, in common developmental issues. That's an amplifier for access. And then frankly, we have a massive training program. We train nearly 900 clinicians every year that come through our doors. Over the last 25 years, it's likely around 10,000 trainees who go in clinical areas who go on. Many of them stay with us or stay local, but then most of them travel to sites around the country and other countries. That's a really important resource contribution that we have for building capacity with this kind of expertise nationally. So when we think about access, we're thinking about it broadly. I should mention also that telehealth is another tool in the toolkit for addressing access. In the last 3 years, we had over 400,000 telehealth appointments, and a good number of those were for out-of-state patients. And I think about for patients, especially those with rare disease, who may live thousands of miles from Baltimore or from wherever perhaps the expert for that particular disease is located. We see telehealth as an important part of addressing really equity issues, so that families need not uproot and travel long distances at great personal expense and disruption to their lives to see that expert. Often a great deal can be accomplished in the space of access via telehealth.
There's just, it's just, I marvel to listen to the description of everything that Kennedy Krieger is doing. An entirely separate area that you also touched on with regard to now and the future, of course, is research, because all the while you're doing this out in the community, you also have physicians, scientists there working on cures for some of these diagnoses that we still don't have a cure or a treatment for. What about research? Give us a sense of what Kennedy Krieger is doing in that arena.
With great intention, we're focusing on our research mission, and that includes everything from scientists who work in a laboratory, sort of bench research, all the way out to clinical work, including clinical trials and more population health concepts, all of it mission driven. And so, for example, one of the important recent successes is recruiting the remarkable Dr. Erica Augustine, who is an expert in rare disease and in clinical trials. And she's our Associate Chief Science Officer, and she's running our clinical trials unit. Her charge is to reimagine that unit to make it possible that every patient who comes through our door, whether they have a rare or common condition, if there's a clinical trial out there, we will make it available to them. That's the vision. And Dr. Augustine has hit the ground running to bring that reimagined unit to fruition. Success in recruiting, well, I mentioned earlier that we have 40 new faculty, physicians, psychologists, and scientists. It's really, many of those people are those who see patients, but also do research. That clinician scientist mentality is key. It's not the exclusive approach, but it's important because it's a way to make sure that there is laser focus on the work that is necessary to improve patients' lives. We also already have this really substantial number of senior seasoned investigators. Our Chief Science Officer, Dr. Amy Bastian, who studies how the brain controls movement, both before and after brain injury. Dr. Ali Fatimi, our Chief Medical Officer, one of the world leaders in studying disorders of the white matter of the brain, leukodystrophies they're called. And then a whole host of early stage investigators. Among those recruited recently are two new bench scientists, Dr. Maya Opendek and Dr. Tomomi Karigo. Both of them are working in that space of understanding how social determinants mechanistically affect health outcomes. Dr. Ebony Lance, Laura Malone, Christina Mertz, Jackie Harris, Matt Elrick, and others who are just getting started in their research and clinical careers and focus on important rare diseases that are all core to what we do. So it is we are growing our research mission. We are recruiting, and our investigators are very successful in getting their own funding. We partner with rare disease organizations to be clear about the work has to be focused. We're not doing discovery for discovery's sake. We are intentional about getting at mechanisms so that we can use that information to improve lives. And then, as I mentioned before, educational research. We have this treasure trove of data in our schools, and it's not just an opportunity, it's an obligation, I think, to use that information to understand how we can create precision approaches to education for children with intellectual disability, and then disseminate that knowledge to others. That's a really exciting direction. And like I say, it's our obligation to do so.
It's just an astonishing, and I know that's not the whole list of everyone you have at Kennedy Krieger who's doing important research, but it is just astonishing just to hear you describe the work that these individuals are doing and to think of what may come from that. I want to come back to the patient. Something else you mentioned. Tell us what you're working, because this is another area of focus, a priority for Kennedy Krieger. Tell us what's happening in the area of patient care, patient attention.
Well, I think a really important direction there is the intent to build an innovative care center. And thank you for sharing at the front end your experience. As you mentioned, 4.5 months you were inpatient. Jeffrey was inpatient, and you and Al were right there with him. And 4.5 months is a long time. It's important for that setting to be a setting where it's not just that you're comfortable, but that you see the space that you're in as part of the healing environment. The hospital is not just a built space to house technology. It really is part of the healing environment. It ought to be. And we need to refresh our facility so that we can meet families, patients, and our staff where they can feel like they're in an environment that enhances the ability to think in innovative ways. So that is really broadly speaking why it's necessary to build a new innovative care center, which will include an expanded inpatient hospital. But it's not just that. It'll be an environment that will allow us to create more mechanisms for innovative care broadly. That's a heavy lift, and we're perhaps the heaviest lift that we've had as an organization in our history. We're in the strategic planning phase of that. We're hoping to garner state government support as well as federal support. We'll be needing donor and community support as well. But it's a really exciting part of our future. We are a one of a kind, like our patients who are ends of ones. We are one of a kind ourselves, and many of our patients really can't be served by anyone else. We say with humility, that's why we exist, and so we know that this is a critically important next step for us, and we are hopeful that the community will rally around us.
So important for people to know that it is the case that Kennedy Krieger is one of a kind for so many of the needs that the patients that you treat. Is there anything you want to add?
Well, a couple things. I think it's important also to say that I've had the pleasure of getting to know some of our patients and families well, and there's a family that I met just within the first few weeks of coming to Kennedy Krieger 4.5 years ago. This is a young man who had what is really a modern version of polio. It's called acute flaccid myelitis. The nerve cells in the spinal cord that directly control muscles die. And that's the polio clinical presentation. Weakness due to that, those nerve cells dying. So I met this family, and they're now part of our lives. We're traveling together in a sense, and it harkens to why I got into this in the first place. I'm a child neurologist. I spend less time now seeing patients than I used to, but the opportunity to meet remarkable patients and families like that one from New York City, come to Kennedy Krieger routinely for boosts of therapy. It's just such a privilege to be a part of their lives and to see the experience through their eyes as well. And then one other thing I want to mention, I have to say this because I'll say maybe you were an inspiration for me to do this. Another way that we're sharing our story and keeping people updated on what we're doing is our podcast. It's called Your Child's Brain. We produce it in partnership with WYPR, our local public radio station. I serve as the interviewer or moderator for these podcasts that anyone can listen to. They're on the Institute's website. They're wherever you get your podcasts. So I hope you'll listen and let us know what you think. And I'm happy to take any tips that you have to be a better moderator. So thank you so much, Judy. It's been wonderful.
Well, what a privilege for me to have this opportunity to talk with you and to hear all these I thought I knew a fair amount about what Kennedy Krieger was up to, but I've just learned a whole lot from listening to you. And I know that the folks joining today have as well. So it's been a treat for me. I want to turn it back over to Linda now because she's going to be in charge of taking these questions and then giving you a chance to respond to those. But in the meantime, thank you so much for letting me be part of this wonderful conversation. Thank you.
It's a pleasure. Thank you, Judy.
Welcome back, everyone. Thank you to Judy and thank you to Dr. Schlager. I'm joined here live by Dr. Schlager. What a special interview. We are so lucky that we learned more about Judy Woodruff's experience here at Kennedy Krieger, and we learned more about your perspective as CEO about the future here.
Well, it's amazing to have the opportunity to, as I said, to get to know Judy Woodruff and to be able to share the story and to have her part of our lives also as part of the board of Kennedy Krieger. You can imagine how immensely impactful that is for us. And we've been able to interact with Judy and her family for I believe since the get-go of joining Kennedy Krieger. That's been marvelous.
That's a wonderful opportunity. Good. Well, I'll just remind everyone who's on the webinar today to please feel free to put any questions you might have into the Q&A, and we'll share them with Dr. Schlager. The first one I'll start with is, what are you most proud of over the past year? You shared a lot in the presentation, the interview with Judy. What stands out to you as CEO over the past year or so?
Just to reiterate the culture of the Institute and how nimble we are, the whatever it takes mentality. It's real. This is not a cliche or a motto. We lived it. I really do buy into this shared leadership. It makes it possible for us to do what we do so effectively, and our staff to a person was remarkable. So the pride is really around the collective efforts of this remarkable team.
Great, thank you. A question about social determinants of health. So you talked about that as part of the Institute's foray and research, obviously links to our schools. Can you explain a little bit about what is that? What is the social determinant of health? And does that link up to the term ACEs that we've heard?
Yeah, so ACEs, adverse childhood experiences, are amongst the social determinants of health. We're talking about poverty, about food insecurity, about inconsistency with having shelter. in lack of access to educational opportunities, and so on. There's a whole list of social determinants that we now know from the clinical outcome studies have lots of adverse effects in terms of chronic health. So it affects the developing brain, but it also, we know over decades that there's a greater likelihood of cardiac and issues and obesity and other manifestations. What we don't really understand is exactly why that happens and to who's at greater risk. And so we're particularly focused on the consequences of those social determinants on brain development. We know that children who are exposed to adverse childhood experiences are at greater risk for disorders of mental health, at greater risk for learning disabilities per se, but we also know that children who have those exposures and who are also at risk for neurodevelopmental issues or have them already, it's not a 1 + 1 = 2 type situation. There is an interaction between those social determinants and those risks for developmental issues that makes the outcome even more poorer outcome. What we want to do with this approach to the center that focuses on those mechanisms is understand why that happens, and to understand on an individual basis who is at greatest risk, to understand how to optimize trajectories. In the perfect world, those social determinants would go away. It's an imperfect world, so we need to understand how those factors influence childhood development.
Okay, thank you. We've heard, a couple of people have heard already in the news about some expansion with our International Center for Spinal Cord Injury. Can you talk a little bit about that?
Absolutely. So with all the discussion, one of the things that we didn't mention in the conversation with Judy was a significant part of our footprint is also in spinal cord injury, which has been part of the Institute for close to 20 years now. And most of the patients that we see in the Spinal Cord Injury Center are adults, because that's where most spinal cord injury happens, but there's also pediatric cases. And we also see patients that have, I mentioned the young man with that polio-like illness. That is a disease that affects the spinal cord, a rare disease that affects neurons in the spinal cord. Our expertise in spinal cord injury per se helps us in our optimal care for patients, even with rare pediatric diseases that involve the spinal cord. The demand for our kind of program is great. The initial Spinal Cord Injury Center was right here in East Baltimore. Just a couple of years ago, we opened our second site, not too far from here, sort of halfway between here and DC and Howard County. And then we opened that during the pandemic, and despite the challenges, that's been a great success, allowing patients with spinal cord injury who live closer to DC, Northern Virginia, to have an easier time getting care. And that because the demand is great, we're opening up a third center. It's likely to open in the fall. That'll be on the other side of the state, closer to Delaware, in White Marsh. Again, to make it possible for families, for patients with spinal cord injury to get care closer to where they live. So very exciting direction. And we are, as I said, it's of a piece. The spinal cord injury program is part of the overall approach that we have to rehabilitation after nervous system injury. And it is an important part of the overall footprint of the Institute.
Terrific, thank you. Dr. Schlager, there's so much in the news, in the media, in our lives about mental health, and really the mental health epidemic that's facing particularly adolescents and children right now. How does the Institute work in that space, and what is our expertise? Can you share that?
So really, it's an excellent question. We are, even before the pandemic, there was a pediatric adolescent mental health crisis brewing. The pandemic has clearly exacerbated that situation. I mentioned at some point that we have 280,000 or so outpatient visits a year. Over half of those visits are for mental and behavioral health. I should also mention that we're talking about the brain, disorders of the brain, mental health, and neurologic conditions. It's all the brain. So our expertise covers the entire expanse of clinical manifestations of disorders of the brain, whether it's depression, anxiety, obsessive compulsive disorder, autism, cerebral palsy, etc. They're all part of issues that relate to the brain's function. So we are fully committed and have been historically committed to taking on children who have psychiatric conditions related to their neurogenetic disorders, but also psychiatric and behavioral health conditions per se. Indeed, we take on some of the most challenging patients that come from all over the country and other countries to be treated in our neurobehavioral unit that is like an intensive care unit for severe behaviors. So from common psychiatric conditions in childhood all the way to the most severe behavioral health conditions, we have significant expertise in that space, and it's core to our mission.
Thank you. And how does the trauma center at Kennedy Krieger play into some of our services?
It's another excellent question. So for decades, we have had it's called the Center for Child and Family Traumatic Stress. We sometimes say shorthand the Trauma Center at the Institute. These are children, back to the point about adverse childhood experiences, these are children that we care for, who they may have developmental issues, but that's not what gets them into the clinic. It's exposure to clinically significant adverse childhood experiences. And we have, again, for decades, had this trauma-informed care. Even before there was a common usage of that term, trauma-informed care, that expertise has been here. And I think it's a fundamental to our mission as well. And it actually motivated this idea of having a Center for Neuroscience of Social Injustice, because that's what we're talking about children who are exposed to these adversities. Again, we know that those adverse experiences have negative effects on brain development, mental health included. So the clinical setup is to take on the clinical needs of those children in an interdisciplinary fashion, with expertise from psychology, psychiatry, social work, and other services that are brought to bear. And in addition to the focus on the child, because we know young parents are often also witnesses or victims of violence or exposed to those same adverse experiences, the approach includes really the family. So this is an important part of our Institute's mission. We see about 1,000 children in that clinic each year. We know that it's critical to what we do, and in the context of the pandemic and all that has happened in the last few years, we know that the focus needs to be on such a trauma-informed approach.
Thank you. I have one more question before we get into a couple of clinical questions, Dr. Schlager. So the first is the interdisciplinary approach. I understand that's unique to Kennedy Krieger. So if I'm bringing a family member in, one of my children, how does that work?
So if you think about the concept of a patient-centered or patient and family-centered care, it's that the experts come to the patient, not that the patient serially sees each of the experts over time. That's the idea, so that the patient is at the center of all the expertise from the different disciplines, who are also meeting with each other to make sure they're all on the same page with the approach of what can be a complex clinical situation. It's not, I wouldn't say it's completely unique to us, but it is our ability to offer interdisciplinary programs, that the magnitude of what we can offer in that space is unique. It's in a typical environment. I came from St. Louis and other academic centers. It's very, very difficult to offer such clinics. It's onerous for lots of reasons that are not they're onerous for the system. Not it's really not patient and family centered. The reasons why that it's onerous. There are reasons why at Kennedy Krieger we can do this, and about 70% of our clinical services, our programs, are oriented towards this interdisciplinary approach. It matters immensely for outcomes, especially for complex situations where you have medically and psychiatrically complex patients.
Yeah, one can only imagine if you're coming in, as you said, with complex conditions or multiple conditions, which the majority of our patients are, that patient-focused and patient-centered care, navigating it is certainly much easier for the family, right, in a very difficult situation. Okay, we'll pivot to a very specific disease question for you. One of our viewers says, is there any treatment for Kennedy de Lang syndrome?
At this moment, there's not a specific treatment, but Kennedy de Lang is an example of the kind of rare disease and the family of rare diseases where we think that we're on the precipice of having specific therapies. And so it's an important question. It's representative of the disease itself, as well as the broad opportunity that's in front of us for rare neurogenetic conditions to have specific interventions.
Thank you. We have a question or a comment actually from one of our attendees that my son is a patient of Kennedy Krieger for the last 10 years. Pierre is his first name. And we have no words to describe how great and important Kennedy Krieger Institute is for us. How can we help Kennedy Krieger as a volunteer and help overseas? We'd love to spread the word about Kennedy Krieger and help people from other countries know about Kennedy Krieger. I feel like this is a philanthropy, marketing, CEO question. What would you say to that, Brad?
Well, first of all, thank you for sharing that sentiment and for the desire to express your gratitude in ways that you described. It's in all of the above. Linda just said, it's an opportunity to work with our development philanthropy office and as well as our marketing office. We want to tell our story more broadly, so that in addition to making it clear that the opportunity to be seen by us is available, but also to make clear that there's this kind of expertise that can be disseminated more broadly. So please reach out to Linda Cameron. You see on the screen, Lisa Nickerson, who directs our marketing and PR department. And we can provide that information directly. And we'd be delighted to work with you to help us tell our story as effectively as possible. There's social media, there's sharing your story specifically, all kinds of mechanisms to make that happen.
Thank you, absolutely. And I would just say for our audience, as you would imagine and you've experienced in your own lives, the past 2 years or so, particularly because of how fragile the health conditions are of our patients, we really haven't had opportunities for on-site volunteering. And we've looked at creative solutions and opportunities to do that. So I think in the coming months, you will see even more opportunities. And we're certainly always looking for advocates on behalf of the Institute, just as one of our attendees offered. And we'd love to partner with you to tell the Kennedy Krieger story, whether it's a video or in person or in print, within family groups, et cetera. So we'll put some information on at the end of this Q&A, and please don't hesitate to reach out. I am going to call on 5 minutes. So if there are any other, does anyone else have any questions that you want to share as we're here with Dr. Schlager? Okay, 2 questions, Brad, and before we put up perhaps the slide. You mentioned 400 published pieces. What does that mean for the Institute and our care and our patients?
Right. So what's the context for publications? What does that mean? It's a big number, but what is it? What it really means is, so we are a resource in lots of ways. We are a resource for direct care of patients. We're a resource by training providers who, as I said, stay put, or many of them, most of them go elsewhere and disseminate the expertise learned here. Another way that we are a resource is through dissemination, through publications, through primary research, through clinical investigation, through review articles. Just in the last couple of weeks, our faculty have had major editorials or viewpoints, types of publications as well, expressing important insights into issues like developmental screening for autism, for example. The expertise of the Institute is the impact through academic and clinical channels through publication is really key to our to the way we function as an international resource. Most of the way that we are known internationally is not because of the number of patients that we see, it's because of the amplification of our knowledge internationally through publication.
Okay, thank you. Well, as we get ready to wrap up, I want to thank you so much, Dr. Schlager, for sharing your expertise, the plans, the accomplishments of the Institute. We're very grateful to Judy Woodruff, too, for her time in this interview. We want to thank everyone who attended today for your support, for being partners in this work. I think there's more to come. I will put in a plug for a couple of upcoming events. One is our Neurodiversity at Work conference. We are having a national or international conference in Washington, D.C., March 22nd through 24th. And it's really an opportunity, again, to learn one piece of the work and our advocacy role here at Kennedy Krieger. We will send everyone a link to that in our follow-up from this. We'd also like you to be aware that we have a 5K for kids at the end of April. It's called Roar for Kids. And then the first Thursday of May is our Hats and Horses Derby Party. All of these events and all of these programs benefit the mission and the work of Kennedy Krieger Institute. So we're really grateful for you joining us today for this Exploring the Brain webinar. There will be more to come, and we look forward to seeing you soon. Can we put up the slide with that information? Thank you so much. Thank you, Dr. Schlager. Thank you to our guests.